I'm Duncan Learmonth. I work at the BMI Priory Hospital in Birmingham. I'm a consultant orthopaedic surgeon and I specialise in knee and shoulder surgery. Well, in knee and shoulder surgery there are a wide spectrum of injuries, from sports injuries, and then there's also like degenerative conditions like arthritis. So we deal with the whole spectrum of the population, from fairly young active sportsmen to patients who are more elderly with degenerative and arthritic problems. Well, specifically in the knee, they're mainly things like cartilage tears, ligament injuries which occur in footballers. In the shoulder there's lots of problems with shoulder instability and rotator cuff tendon tears. Some degree of arthritis in the shoulder, but it's certainly not as common as in the knee. Typical patients are usually middle-aged. They're usually people in obviously very good jobs, and they usually have some form of sporting background. And usually the thing that brings them to us is that they've either got problems with their joint in day-to-day activity, or it stops them being active in sort of sports and physical activities which they enjoy. It varies. I mean, it depends on each individual patient, but there are certain instances where their medical health might be such that doing any surgery would be dangerous, or if they've had any previous surgery where there may be some underlying infection or nerve damage whereby it would be risky to do any further surgery. One of the reasons I went into orthopaedics was that a lot of the patients that have surgery do very well following the surgery, and there's certainly good medical evidence that people that have procedures like knee replacement operations, knee ligament operations, do get significant improvements in quality of life. And also in the shoulder as well, with rotator cuff surgery, there's been certainly a lot of evidence to suggest that people do very well following rotator cuff repair surgery. I mean, it depends again what's caused the symptoms. I mean, if it's an injury, a soft tissue injury where there hasn't been a lot of swelling or loss of movement of the joint, then I think it's perfectly safe to leave things for a 3 to 4 week period before seeking any advice. But if symptoms have persisted beyond then an early scan would be helpful. In conditions like arthritis or problems in the shoulder with tendon tears or tendon injuries, then again you could possibly leave that for a few weeks or a couple of months. But again, if symptoms persisted after that, then an urgent or a fairly quick scan or x-ray would be very helpful. It's been well recognised, in fact, that patients who leave arthritic joints for too long, where the joint becomes very stiff, they may not have the same functional result of someone who's come a bit earlier, where they've had good movement and good muscle tone in the joint. And it's certainly been well shown in patients with rotator cuff tears that again, if they leave that shoulder too long, they develop secondary changes around the movement of the shoulder blade or the scapula, which then may make their recovery and rehabilitation more difficult after the surgery. I think with all operations you have to speak to the patient in detail before the surgery so that the patient's expectations are going to be met. Not every operation is going to make everyone completely pain-free, and that needs to be talked through with the patient. But I think the job of our role as surgeons is to make sure that each step of the process, be it the pre-hospital or pre-surgical rehabilitation, the inpatient care, the immediate aftercare in hospital, and then the rehabilitation once the patient's been discharged, that needs all to be perfect in order for the patient to have the best possible outcome. Well, there's a whole array of options other than surgery, and again, in a lot of cases we will try a lot of conservative treatments before going to surgery. But if surgery is not an option for a patient, other treatments such as physiotherapy, chiropractor, osteopathy treatment may be helpful. Also, some of our anaesthetists that run pain clinics or specialists in pain management may be very helpful for patients.